everyone.
Hi.
So, I am back with a very special video because I finally have my dermatologist, Dr. Osei Tutu, here with me in the flesh. And we're going to be, kikiing a little bit, answering some of your questions, and just getting to know more about who she is, what she does, and what she specializes in. And I really hope you can appreciate this video. So, without further ado, I'd like for Dr. Osei Tutu to introduce herself to you.
Hi everybody, my name is Dr. Osei Tutu. I am a board-certified dermatologist specializing in medical hair loss and hair restoration.
Okay, so how long have you been practicing dermatology?
I've been a practicing dermatologist probably for the last 6 to 7 years.
And what inspired you to do so?
Well, you mean hair restoration or just dermatology in general?
Dermatology, and then how did it spawn into hair restoration?
Okay. Well, I think dermatology interested me because I liked the fact that I got to do procedures and I was able to see a wide span in terms of age of patients and sex of patients. So there's a lot of variability in dermatology. You know, you can be seeing an acne patient one day, you can be seeing a really crazy rash, and then the next day you can be doing a skin cancer surgery. So I thought that was interesting.
Okay, that definitely keeps the job interesting because every day is different.
Exactly.
Yeah.
And for somebody with the un poquito de ADD, it's great.
Yeah, I totally feel you on that. I totally feel you on that.
Why I got interested for 2 reasons. Number one, because I have suffered and do suffer from hair loss.
Really?
Yes. You
I
didn't know that? Okay. I do. So I have this sort of androgenic or hormonal type hair loss that a lot of women in my family suffer from. And then before I knew better, I was doing the really, really tight braids or leaving them in for, longer periods of time than it needed to be. And so I had the addition of having some traction alopecia. So this part of my hair, if I don't use Rogaine, and I use Rogaine every day, is completely bald.
Oh.
I wouldn't be able to wear this haircut. It was really hard for me to go natural. And so Rogaine is the only thing that kind of maintains this hair. Eventually, I will have to have a transplant myself. When I stop using the Rogaine, my hair falls out. So that was the first reason. It was selfish.
Okay.
The second reason is because I do have a family member who suffers from that CCCA condition that I talked about. And, just listening to her being upset, crying, figuring out how she's going to navigate her world in terms of styling, dating, all of those things made me super sensitive to the struggle. Yeah. So.
Well, you mentioned Rogaine and you having to take it because I remember you recommended I take Rogaine, but you also told me that I could stop.
Yep. So I remember you have hair from here.
Right.
That is not subject to the issues that were here.
Okay.
So we just used Rogaine in the beginning. When you transfer hair from here to here, it's like, whoa, what are you doing? It gets shocked, right? And so what happens is that your hair goes through this cycle of telogen, which is shedding. So you may experience a little bit more shedding when you transfer the hair. So the Rogaine will help to sort of mitigate that shedding. For me, because I have not transplanted my hair, these hairs are subject to that hormonal situation that I was discussing before, and also the traction. So once I transplant my hair, I won't need the Rogaine.
Okay, because a lot of people were asking me, or rather telling me, you're going to have to take Rogaine for the rest of your life now.
And you stopped, right?
Yeah,
and you're fine.
My hair hasn't fallen out, so I'm really good.
I think, one has to remember it depends on the type of hair loss, right? So for patients with traction, with your condition, you use it for that finite amount of time, and then after that, you don't need it. If you do suffer from androgenic alopecia, the hairs or the hormonal type of hair loss, the hairs that you transplant here are fine, right? But somebody with androgenic alopecia, not necessarily in my case, let's say for men, for instance, guys, let's say we transplant this whole part of the hair. They still have androgenic alopecia cells in the back of the head. So they need to use Rogaine in order to maintain the whole situation. Otherwise, what will happen is that they'll have the transplanted hair, which will stay, and then they'll continue to lose hair from the back. So it's used to maintain it, but you don't have that chronic progressive condition. So not so for you. I think that education, part of my job is being a dermatologist and part of my job is being interested in hair loss and treating hair loss is education. The condition that I had mentioned before, the central cicatricial centrifugal alopecia, I see so much of this in my office, probably about 20 to 30 cases a week. And that's astounding, right? When you speak to a lot of our colleagues, people are starting to say that it's epidemic in the community. The problem with this condition is that if you do not catch it early, there is basically nothing that I can do. So if you start with an area in the center of your scalp that's breaking a little bit, where you're starting to have symptoms, maybe where you have a little bit of hair loss, if you catch it early, there are some things that we can do to help to sort of calm it down. If you come to me when the center of your scalp is bald, I can't do anything. One of the issues that I find that we are guilty of as women of color is that we see something, it's damaging to the hair, and we continue to do it.
Yeah.
Right? We've all been guilty of it, me
Yeah.
included, right? And we have to learn how to listen to what our scalp is telling us. Because if you piss off your hair, it will piss you off later on. Yeah.
I can definitely attest to that.
Yeah.
And of course, that's why I had the issue to begin with. When you're not looking right on the outside, it really affects your self-confidence levels on the inside. And that's when I decided, you know what? Not only am I going to find a dermatologist, I'm going to find a dermatologist that understands what I'm going through. A dermatologist who even looks like me. And let me tell you, you were so hard to find.
Oh, no, why?
You were hard to find.
Why?
So I discovered you on ZocDoc.
ZocDoc. Okay.
I discovered you on ZocDoc.
Okay.
And out of like over 100 folks that I screened, you're the only black woman.
Interesting.
You're the only black woman. There was a woman of color, but she was Indian.
Okay.
You know, I didn't really want to. And of course, there was a black man, but I really wanted a woman because I don't think maybe a man would understand because they do suffer from pattern baldness sometimes.
Of course,
but
yeah.
I really just wanted someone that was like me.
Sure.
And what do you know? I found you, and
Yeah.
not only that, you are experiencing this. You also have natural hair, and you just understand the struggle.
Sure, of course.
So I'm just so glad to have found you.
It's not necessarily about what the person looks like in terms of finding a doctor. A lot of it is just where the person happened to train, right? In my program, I trained at Downstate. There were, I was one of a few persons of color. So if you trained at Downstate in the middle of East Flatbush, Brooklyn, with an African, Afro-Caribbean population, you're going to be aware and very sensitive to the issues that affect women of color. So it's more of where the person trained. So I don't want, your viewers to get the message that only a black woman can treat you.
No, I understand. I feel like
you just felt comfortable.
Yes, I was comfortable, and I felt like you could relate more to my struggle.
Got it. Okay. I think it's really important for me to get the message out about, as I stated before, listening to what your hair tells you. Right. Don't just attribute everything to stress. Don't just use Jamaican black castor oil to treat all ailments. Because sometimes you have a real issue. And that scarring alopecia is not the only issue that we see. One can have alopecia areata, which is an autoimmune, type of issue. You can have lupus on the scalp. Right. So if you're having a problem, seek the help and the advice of a dermatologist. And make sure that you don't need to do something to actually start using medications. Because if not, if you wait too long and start trying to treat it on your own, you may run into a problem that by the time you get to the doctor, there's absolutely nothing that we can do. And that is what makes me so upset. It's women who are relegated to wearing wigs indefinitely because it's the scalp is so scarred. So I think that is sort of one of the most important messages. The other thing is about just how we groom ourselves, being really careful about pulling too tight and loving your hair. I mean, you wouldn't do that to your child, right? Like pull their hair to the point where the child has a headache. Don't do it to yourself. Right. When you go to get your hair braided or when you go to get your hair done, whether you're still relaxing or whatever process you get, be your own advocate. If something is hurting, say ow and say it loudly, because ouch and pain is a signal to the body that something is going wrong, right? If the scalp is hurting, if you're having to suffer from a headache, 2 days after you get your hair done, it's a problem. And if you do that repeatedly over time, you're going to lose the hair in that area.
So it's not all about those tight hairstyles,
Absolutely ladies. Not.
Them sleek edges.
Absolutely not.
You got to take care of yourself.
Exactly.
Listen to your scalp.
Listen to it.
If you could elaborate more on the requirements for being a candidate for hair restoration.
Sure.
Because not everyone is a candidate for hair restoration, unfortunately.
Yeah. So before I do that, I think that we should very quickly address some of the hair loss issues that we see in the clinic. Yeah. And one of the more common things that I see is something called centrifugal centripetal alopecia. And it's a scarring type of hair loss that we tend to see a lot in women of color. And it typically occurs in the center of the scalp. You may get some unexplained breakage or, symptoms such as soreness or pain or numbness and tingling, and that can very quickly or slowly progress to you basically having an area of baldness in the center of the scalp, and it kind of spreads outward. The unfortunate thing is that we don't know what the heck causes it specifically. There are some genetic factors. Some of the things that we do as women of color in terms of grooming, the braiding, the weaving, the direct heat also may contribute to that.
Right.
So if somebody comes to me mainly with traction alopecia, which is the hair loss that we see here, I always check to see if there's some action going on here. And I always ask. If there is, then it's going to be much more difficult for the transplants to stay. Sometimes that disease on the top of the scalp is also, you can also see it on the back. So it's very, very important to examine and rule that out.
Okay. And when you do the procedure, is it you or do you bring people on board to perform it?
So it's me, and as you were there that day, and my techs. So so we work as a really nicely well-gelled team in order to do the procedure. And there are two types of procedures. You did the strip surgery.
Right.
So I think that's an important distinction to make. So one of them is called a follicular unit transplant, where we take a strip of hair, we get that hair, we look under the microscope, we cut the hairs into the little groups, right? Because hairs are grouped into one unit of hair, 2 groups, 3 groups, or 4 groups. And so we cut them into their natural groups because at the bottom of that hair follicle is all the information. So we then take those follicular unit groupings and then we put them back into the area that has hair loss, okay? The other way to do it is to take a tiny little tool called a punch, and we shave a lot of the head, right? And then we go in each follicle and we take the hairs one by one.
Each individual follicle.
Right. So obviously that takes a lot of time.
Right.
And in persons of color with, our type of hair, the hair is curly on the outside and curly on the inside. So you can imagine trying to get the hairs at an angle that won't destroy that information on the bottom. Right. It can be done and it's done successfully, but it just takes a lot more time. So I would say for women like yourself and myself who are not wearing their hair super short and shaved, the strip works fine, right?
Yeah, the strip works fine.
Exactly. Because you typically wear your hair covered. You will have a scar, and I mean, you can sort of attest to this. I think if it's done properly, you can have a really nice, small scar, and anyway, your hair is over it. We do tend to scar a lot more in terms of keloids in persons of color, so that needs to be monitored over time.
Right.
The follicular unit extraction, where we take the little tool and take the hairs one by one, I would probably sort of push somebody who wears their hair a lot shorter. So for men of color who tend to wear their hair very cropped. Because obviously you don't want a big strip scar in the back of your head.
Right. And you'd still be able to take out this... Okay.
It's more challenging, but it can be done. And, you want the person to do the surgery and enjoy it, right? But then they're going to have to worry about them having to wear their hair short and then having a big... scar in the back of the head, which is not attractive. You don't want everybody in the world to know that you just had a big procedure.
Right.
Yeah.
So you do procedures in both men and women?
Yes.
Both the strip and the...
follicular unit extraction. FUE.
FUE, yes. In my situation, we did the strip. Now, you were telling me before when I went to see you a couple months after about the density of my hair units and that sort of thing. And because, I mean... like everyone's hair texture is not the same.
Exactly.
Like you can have very thick hair or your hair is very fine or in between. And my hair in the back, it wasn't as thick.
Yeah. So let's say on average, people have like about 100,000 hairs on the head, plus minus. Persons of color, we found through studies, have between 20 and 40% less hair when you compare it to somebody with blonde hair, right? So when you're doing a transplant on, a Caucasian person versus a black person, the amount of hair that you're going to, let's say we take a strip that big, the amount of hair that we're going to have is going to be less, with all factors being the same. Now, in a group of persons of color, you're going to have different densities of hair, right? So you're already starting with a little bit of a lower density. You're going to have varying densities and varying thicknesses of hair. So if we take a strip that big and somebody has a bunch of hairs in that one area and the hairs are super thick, when I transplant it, it's going to be the bomb, right? Because their hair is going to be super thick. But in somebody who has really thin hair, a really low density, it's going to be, sort of want. You're going to have, and we've transplanted the same amount of hairs. You're just not going to have as much coverage.
Okay. With
somebody with the less amount of density and the thinner hair. So I always try to explain that to people as well.
Okay, so folks who have finer hair, the progress here won't be as...
Yeah, I mean, you know, depending on the extent of it, because a lot of people want to do their procedure all, like, on the same day. But if you're coming to me with this much hair loss, the whole side, and it's even encroaching on the area. Remember, we took your hair, like, in and through here? Some people have hair loss that encroach on that part, right? So if your hair loss is encroaching on the part where I need to take the hair, you're going to need 2 procedures. You don't want to hear that, but that's just the truth.
Right.
There has to be a level of safety, and then also trying to get the proper grafts. And I know it's like a whole big deal to, like, come back a second time, but in the end, it's probably going to be better for you. And again, with persons of color, right, it's like I'm trying not to take out too much because with the strip, I have to close the scalp.
Right.
So if I take out a lot of hair to get more grafts, I'm risking not being able to actually close your scalp. And that's not cute, right? You want to take just the right amount so that it's safe and that we get so that you're satisfied and that I'm satisfied in terms of you being safe.
Okay.
Yeah.
Have you ever taken out a big portion?
Never. I am not a cowgirl or a cowboy. I'm super conservative. And, and you know, if that is not something that is appealing to you, then it's fine. You can, you know, that's why I also recommend other doctors. But I do what I do because I like to sleep at night without having to worry about too many things. So I tend to be super conservative.
Yeah, I think you actually, before I was 100% into the procedure, you referred me to one of your colleagues.
Exactly.
And he told me about FUE procedure, and then he told me his price, and I was like, maybe not.
Not so much.
Yeah, it was in a very snazzy part of town.
Yeah.
But.
I mean, I started doing this procedure because I also wanted to make it available, right? Obviously, because I'm a woman of color, people who are also women of color will be naturally attracted to me,
obviously,
right?
Yeah.
And so that was number one. And number two, there's no point, in my opinion, of having a procedure if, like, I'm the only person who can afford it, right? Like, it needs to be widely available. So I try to make my prices relatively reasonable. Yeah.
And are there payment plans or?
So yeah, I mean, you can do a couple things. There are something called Care Credit, which is like a healthcare credit card that we offer in the practice. And then there's something called Prosper Health. It's like a very low interest. They check your credit, but it doesn't affect your credit scoring. And you get decisions very quickly. So there are a couple options.
Okay.
Yeah.
So for those of you who are wary about the price, you can definitely look into that.
Yeah.
For those whose edges have suffered, but haven't been scarred, I know you mentioned something before about some essential oils possibly helping with stimulating hair growth. So, you know, we try as much as possible in science, medicine, and dermatology not excluded to practice evidence-based medicine, right? So we've read a study, you know, it's worked for a large majority of people, and then we start employing it in our practice. Part of medicine is not just science, but there's some art. You know, we use anecdotal, you know, studies to also practice medicine. But there's some data on rosemary oil and stimulating hair. So I often tell my patients, you know, you can use rosemary oil, maybe, you know, 3 to 6 drops in a tablespoon of jojoba oil or grapeseed oil to help to stimulate the scalp. There was also a study on alopecia areata. Alopecia areata is this autoimmune condition where the body for some reason starts attacking the hair. And there were things like lavender, rosemary, thyme, cedarwood oil used, and it also showed that it can improve that condition as well. But that is not the go-to treatment. The go-to treatment is the medical therapy. These would be just supportive. Okay.
Yeah.
So I'm actually going to be taking a question from Snapchat because I did ask folks on Snapchat to send in questions. And Miss Tonya asks, what can she do about hyperpigmentation around the mouth? Oh, that's a really good question because usually around here where I get, you know, laugh line creasing, it is a little darker here. I get this like 5 o'clock shadow sometimes. So is there like a natural remedy for that?
So it depends on what the cause is, right? First, we need to make a diagnosis before we decide what the treatment is.
Okay.
So hyperpigmentation around the mouth can be caused by many things, including something called melasma, which is a pigmentary disorder that we often see in persons of color. So for some reason, the cells in the skin that give you your nice, beautiful brown color, they tend to spew out their contents on the top of the skin and on the bottom of the skin. So that can produce a brownish, grayish discoloration.
Wow.
That is treated with bleaching creams and sunscreen.
Okay.
A natural remedy for that, you can use kojic acid or licorice root extract. It doesn't work as well as, a prescription bleaching cream, but, and then after you sort of get to the color that you want, because this is a chronic condition, even with the creams, you have to always do something to maintain it.
Yeah. So you wouldn't need to keep using those types of...
You would need to use a bleaching, or what I do is use a bleaching cream initially and then use something that's skin brightening. So something that has kojic acid or something called arbutin or licorice root extract.
Or even like maybe lemon juice or lemons?
So one has to be careful about lemon juice and lemon. I know that there is a lot of anecdotal data about its benefits in terms of skin brightening, but lemon juice has also some acidic properties, and that can also burn. People have come in here using lemon juice with burns. Ooh. So you gotta be careful. Yeah. Okay. Yeah. Another cause of hyperpigmentation around the mouth is eczema, right? So some people have contact allergies. You need to treat the eczema and then treat the dark marks after that. Another more common cause is just hair, right? Some of us are a little hairier than others. So if that's the case, that also tends to produce a 5 o'clock shadow, and you need to do laser hair removal and take care of the pigmentation afterwards.
Okay. But doesn't laser hair removal, like once you stop doing it, the hair grows back though?
So, yes and no, right? So laser hair removal for any person of color, I would say, is laser hair reduction and not permanent laser hair removal. You would basically need to do, depending on the amount and thickness of the hair, anywhere between 6 and 12 sessions, and then you need to do maintenance sessions afterwards. Yeah. Okay. Yeah.
Because I tried to do laser hair down there, but it didn't work.
What does that not work mean? What happened?
I mean, when I stopped doing it,
right,
it grew back.
Right. So that's the kicker that you need to tell. That's how we keep you coming back. It's the crack. Oh, man. Yeah, I know.
I have oily skin.
Okay.
And I don't know what the white stuff is called. You know when like you extract? Because sometimes I do extractions. I don't know if that's okay.
Yeah, so it depends on how you do them.
Okay.
Oftentimes, patients come here and they're like they look like they've been in a battle because they've been picking at their skin. So you just have to be careful. Extractions are okay. You want to make sure that you're really gentle to your skin.
Right.
Anything that we do as persons of color that does any amount of damage, even if you don't touch a pimple or a lesion, it can lead to hyperpigmentation. Right. So you'll end up getting lots of dark marks on the face. So you have to be really careful about that. And then, we have to treat that as well. So, yeah. I
mean, I do perform extractions maybe once a month just to get the white stuff out.
How do you do that?
I use an extractor.
Okay.
It's like, and then, I usually just get the cheeks and the chin because that's the more fatty parts. That I'm comfortable with, like the forehead and outside is very tight, and it hurts every time I try to do it, so I don't even bother. But I usually just get the white stuff.
And is this a metal extractor that you're using?
Yes.
Okay. So I would be very cautious about using anything metal, only because I see all the time in my office people purchase those things and they end up damaging their skin. So if you're going to do it, you need to tread very lightly. Also a good thing to do is maybe just try 2 Q-tips together to try to extract some of the lesions out.
2 Q-tips? That's going to take a long time.
But it's safer.
Okay.
Just because I see so much of the hyperpigmentation in the office from people trying to do too much extractions with those metal instruments.
Okay, better safe than sorry.
Exactly. Then you have to pay me to do a chemical peel. Why save your money and do it safely?
Right? So what other services do you offer in your practice?
Oh, we do everything. So we see acne and eczema. I do peels. I do laser hair removal. I do photo peels. I do pretty much everything. Skin cancer, everything.
Do you do fillers also?
I do fillers. And Botox.
Okay.
Yeah. I mean, my favorite is, at this point, hair restoration because of all of the things that we talked about. And I feel like when it works, it's the most satisfying, and people, as one of my favorite patients says, it's a game changer. And that's like her voice.
It definitely is a game changer.
So yeah, it's the most fun procedure for me to do.
So where are your offices located?
So my main office is in Great Neck, Long Island, and then I also see patients in Brooklyn once a week.
Okay. I remember coming to you in the Brooklyn location, and you actually performed the procedure here at the Great Neck location.
Exactly.
So if any of you guys are in the tri-state area, definitely check her out. And also, do you do any online consultations? Or?
Yeah, so we do virtual consultations, but mainly for people who live in New York, because I'm licensed to practice in those states. So if I have to send any medications or anything like that, those are just what the laws dictate. But I do get a lot of clients who want to consult with me who are out of state, and so I will send them specific speculations in order for us to have a discussion, because it has to be done safely and legally as well.
All right.
Yeah.
So there's like no possibility of someone from another country coming.
Sure. So what I usually recommend if we're gonna kind of move into, is it hair transplants that you want to know about?
Yeah, let's say hair transplant.
Okay.
Yeah, hair
So
transplant.
if somebody wants to do a hair transplant and they're out of the country, what I ask them to do is just basically go see a dermatologist where they are and make sure that there are no other scalp issues, no other scar and hair losses that would preclude them from getting a hair transplantation. And as long as I have that documentation, I take a look at some images, then we're kind of good to go. But the best thing would be for the person to come in and let me get my hands in the head.
Right,
yeah.
right. There's nothing like hands-on,
exactly,
tangible.
Exactly. And then obviously, because my eyes have seen so much hair loss, I'm able to very quickly tell if the patient is a candidate. And I often do scalp biopsies on patients because there's a lot of issues with hair loss in women of color. And if you do have a scarring hair loss, it's going to be much more difficult to do hair transplantation.
Oh, I do want to ask you.
Yeah.
Do you have like a blog or social media do you have any, are you on social media? Do you have a blog or?
I am, but like fake, It's
Fake? What does that mean?
I'm just not very active.
Okay.
I'm so busy, unfortunately, that I don't have time to, Instagram and do all that other stuff. I need to get better at that. My patients have told me.
Yeah.
So I'm going to try.
Yeah, I think you do really good, especially on YouTube, because you have a very nice speaking voice and you're just very confident in what you say. And it just seems like you know your stuff.
So you think I should have a YouTube channel?
Oh, for sure.
Okay.
Thumbs up if you think she should have a YouTube channel.
I'll have to think about it.
No, you should, definitely.
All right. I think that for me, the education piece, as I discussed with you before, is super important. So as many people hear about some of the issues that affect us in terms of our hair as women of color, the better.
Oh, and I want to talk about Ghana.
Yeah.
Do you want to talk about Ghana?
Sure, let's talk about Ghana.
Okay, well, you plan on going to Ghana,
Yeah,
right?
so obviously this issue of hair loss in women of color does not just affect women in the United States. I am Ghanaian. I was actually born in Ghana. I came here when I was a little baby. And so have always been interested in doing stuff there. I've done a couple projects in telemedicine. And recently had the idea of doing maybe like a little luncheon for women in Ghana just to discuss hair loss, hair grooming. And so going to Ghana in December to start to look for locations, and God willing, sometime in the spring I'll do something.
Okay, so if any of you guys are in Ghana
or Nigeria or the surrounding area,
be on the lookout.
That's right.
On her Twitter, on her YouTube,
which I
on
will
her
start
Facebook.
after today.
Yes, you got to keep people informed. And if you have like monthly events somewhere here in the tri-state area, I'm sure everyone would love to know.
Yeah. So I often partner with stylists to do like hair seminars and talk about some of the issues that affect women of color and hair loss. So that's super important to me. So if there are any stylists out there who want to educate their clients, I'm always available.
Stylists.
Yeah.
Do you hear that? Holla at them.
Holla. That's right.
On her Facebook, Twitter, YouTube.
Which I will start after today.
Yes. Yeah, that's all for this video
today.
Thank
you for coming to visit me.
Thank
I
you
appreciate you. You're one of my favorite patients.
Oh, I'm a favorite. That makes me feel so good. I love being someone's favorite. That's the best
I think that you have done a really good job at opening yourself up and teaching people about some of the things that you've gone through, and has made it easier for people to also voice their struggles. And I think more people need to do it. I go back to the fact that there are so many women who come to my office and I can't do anything to help them. And if they would have just come a little bit earlier, or maybe watched some of the things that you do, they probably could have been helped.
Yeah,
so.
it was really hard for me to make that video. Like, I was to the point of tears, and Alan, my boyfriend, had to like console me, like, Jasmine, it's not that serious, but it's serious.
No, you've done a great thing, and you've helped a lot of people. So kudos to you.
I just feel like a huge weight has lifted off of my shoulders.
Good job. Good job.
I'm so thankful.
Yeah.
I'm thankful. In the month of being thankful, I'm thankful for you. I'm just thankful for this whole experience.
Yeah. It's been great.
And I want to thank you all so much for watching this video. If you enjoyed it, you know what to do. give me a thumbs up. Give her a thumbs up.
Bye.
Just give a thumbs up. I don't know what to say. If you have any other questions for Dr. Osei Tutu, please leave them in the comment section down below. And hopefully she will answer them.
I'm happy to answer any questions at all. Yeah. They can also go to my website. We have a clinical platform where we sort of discuss things back and forth with patients. Or even if you're not my patient and you have a question about hair, feel free to ask.
Awesome. Definitely check out her website. I'll leave it in the description box down below. Ask her questions. She will answer them.
That's right.
Right? Okay. Feel free to share this video with anyone who is suffering with any form of hair loss or even like skin issues or any issues surrounding dermatology. I'm sure they would appreciate this sort of information. I'm sure they would appreciate Dr. Osei Tutu's expertise on these matters. I'm sure they would thank you for this, right? So share this video. Yeah. And remember to subscribe to my channel because I make videos every single week for you guys, mainly Sundays and Thursdays for you. And I want to thank you all so much for watching and supporting and subscribing to my channel. And I will see you all in the next one. All right.
Good job.
Thank you.
I'm so impressed with you.
I'm impressed with you.
Good job.
You're just so easy to talk to.
Well, I told you like my sister.
Yeah, you are my sister, girl.
That's right.